Hi, everyone. Today, I have the most special guest today. This is a friend of mine from medical school, Dr. Artie Abello. Dr. Artie is an emergency medicine physician, and he started his own freestanding emergency room. It is completely physician owned and operated. They have 6 locations around Austin and Texas. It is called Ally Medical. And Dr. Artie is not very active on social media, so I am so excited to have him here and to tell his story. Thank you for being here today.
Thank you. Yeah, I'm very happy to be here. I appreciate you asking me.
Sure. Can you tell us a little bit about your story and what led you to start this freestanding ER?
Yeah, sure. So we're in Austin and Houston. After finishing medical school, I went to residency down in South Texas. There happened to be some attending physicians and other physicians in the community that were starting freestanding emergency centers. And for those of you who are not in Texas, I believe most states have freestanding emergency centers. They are usually only allowed to operate as satellites of hospitals that are in existence. But in Texas, they can open up as with individual licenses and be owned by physicians. So that's something that we have here. So you can have an emergency center that has nothing to do with any hospital and remains operating and licensed independently. And so where I went to residency, some of the attendings were starting them. You know, they were working in hospitals that were very busy, not being listened to with their valuable clinical opinions, and they put their money together, borrowed from the banks, and opened up their own and asked me to join. When I moved to Austin, I asked if there was expansion possibilities there, and they said, no, we're happy. We're in our own market. And so I gathered up 4 of my other founding partners and dozens of other physicians in the area and said, let's do this. And it's been an amazing experience.
Yeah, that's awesome. And how is it different from working in a hospital ER?
Well, so I did work for hospitals for multiple years after residency. I found that my first couple contracts were dead ends. That there was no partnership track that was originally intended, and so I was working the sweat without the reward. I started taking some PRN contracts around Texas that were highly lucrative, but of course they are for very obvious reasons, because there were no physicians taking those positions, and there were hospitals in different states of, should I say, repair. And so yes, I did work in the hospitals before, and I was rushed to see patients, to chart quicker, to basically the only give was speaking to the patient less. I found myself working with a scribe at rapid pace, taking unnecessary risks and spending up to 90 seconds explaining to the patient what was going on, because there simply wasn't enough time to get it all done and still practice effectively and clear the waiting room. Additionally, we would have responsibilities upstairs in the hospital for code blues and whatnot in the ICU after hours when there were not physicians present. So that became untenable and made me really question what I got into medicine for, which was to really sit down with patients, give them the standard of care, and have them leave understanding what is going on and not in confusion.
Yeah, that's awesome. And do you have any of that in your freestanding ER?
Not at all. Because we own and operate the places, we make all of the clinical and business decisions. We pride ourselves on being slow, actually. We have every physician that we bring on as a partner, we look into them, and a lot of our best ones were faulted for being slow at the hospitals. And that's a good thing. That means hopefully it's not slow for any undue reason. Oftentimes it's slow because they like to talk to their patients and give them an understanding of what's going on and what might go wrong, because we don't get it right in acute care. And that's just a feature of the timing that we have.
That's amazing. And I actually have a friend here in town who works for Ally Medical, and she is so happy. She came from one of the big systems, and she was let go during COVID, and which is the strangest thing. I mean, how can you get rid of doctors during the height of the pandemic? And luckily, because of that, they had to let go of her non-compete. She had a non-compete that made her want to have to drive out of town a few hours. And so she joined your freestanding ER. I've never told you this, and she is absolutely ecstatic. She absolutely loves it. And
Great, yeah.
and
That's
it's awesome
so
because I can keep doctors in medicine because that's
That's
great to
so good to
practice.
hear. Yeah, there's a few of our partners have remarked that they were really thinking about leaving medicine, and that's a shame. That's so much time and effort and blood, sweat, and tears of them and their family that went into that, and all the people who taught them along the way. I will say that our physicians are not under non-competes. So, in fact, if you're PGY, 5 or something like that, you should be working at hospitals and getting some of those cases that don't come to these smaller centers. So we let people work wherever else they want. Ownership is a different thing, but unfortunately, hospitals have a different way of doing structuring their non-competes. So that's something that we pride ourselves on. Work anywhere else, get experience, build your career, and have a diverse sort of practice. That's really what you got into this for.
Yeah, I agree completely. I think it's all of the diverse experiences that we can experience as physicians that make us better. And I think these non-competes are just stifling creativity and innovation, and they make it impossible for us to really move forwards and get better. So I think that's great. You're retaining your people by being good to your people, which is how it should be.
Yeah, who would have thought?
And so all of your practices are owned by physicians. Something that I was wondering, you guys don't take Medicare, is that correct?
We do not. We're not recognized by CMS, Medicare, Medicaid, TRICARE.
So it's because you're not allowed to, not because you
Correct. We actually wanted to. There was a window during COVID where the government said, "Hey, you guys can take Medicare and Medicaid for this limited period." And so we looked at it, and they did not specify that we were not under the same scrutiny for Medicare and Medicaid that hospitals had always been, which is providing respiratory therapy, food service, and those sorts of things. And so at the end of the day, we said, well, you're going to let us do something, and yet we're in violation already of doing so. So can you please clarify? Can you please elaborate that we are? And they didn't have a response. And we were so busy at the time that, we had a lawyer ask the question and we didn't get the response. And so that made it very clear to us. But it is something that we lobby for as not very successfully, but we do have legislative participation where we ask for because my parents are Medicare aged and many people are, and fortunately we're able to work with their coinsurance and be paid for a small portion of it, but Medicare will not recognize us, so that's something that I hope will change in the future. We really want it to.
Yeah, it sounds like you're absolutely for the patient and for the physician, and when you put the physicians in charge, you can provide better care, which is awesome. And I really love that you take doctors who've lost hope in medicine, because there's so many physicians that are considering leaving medicine. I believe the number is something like 78%. And I really, really believe that if we as physicians on an individual and as a group, if we can remember why we went into medicine and see that it is what we expected it to be, there can be hope. There can absolutely be hope in the future.
Absolutely.
Is there one person or event that inspired you or still inspires you and gives you hope for the future of medicine?
Yeah, I would say that my sister, who's a primary care medicine and pediatrics physician in one of the suburbs here, continues to be an inspiration. She has continued to prioritize the patients despite her practice being purchased by a hospital system and all of the things that carries with it. She is aspiring to improve that situation, but still never wavers in taking care of a good amount of patients every single day, and being recharged by that sort of energy. So I think that is something that we need to recognize in our primary care providers, that they have a lot of things that are going on, but they can still focus on each and every patient and see high volumes and, remain dedicated without being discouraged.
Yeah, that's amazing. So you started your own freestanding ER. That's a big undertaking. Do you have an MBA? How did you know how to do this?
I don't. And I will say that me and almost 80 other physicians started our own. I have four founding partners, but we have about 80 physician shareholding partners and no other investors, no outside equity, private equity. I don't have an MBA. One of my partners did go and get an executive MBA, and I thought about it. Frankly, I drank from the fire hose in early days of business, and I didn't have time to go get one, and I had an opportunity to go back and get one. I actually think my partner learned a lot from his executive MBA, a lot of vocabulary, ways to think, and networking. I was able to. We're smart. We're all physicians. We gather information and prioritize it. I think that not having an MBA was an advantage, actually. I saw things differently from him. We collaborated and bounced ideas off of each other, and that was highly valuable. So I wouldn't tell anybody not to go get an MBA. They're certainly valuable, and they have a lot of valuable features. They're a bit expensive, but still affordable. However, you'll get an appreciation for the business aspect of it as a physician that's learning it. It's unique, and frankly, for your listeners, I practice the minority of the time. Most of what I do is business administration for us because we don't want to have anybody else make decisions besides physicians. Do I miss it? Yes, a little bit, but I really love creating jobs, creating these avenues for better care and clinical opinion in the administration of medicine. And so that's what keeps me going. But you don't need an MBA. You can bootstrap it yourself. You need a mentor, most likely, and that can come from any sector of business or even from other physicians that have laid the groundwork for their own private practices. So yes, do keep an open mind about that, but get the MBA if it does move you.
Yeah, as physicians, we're so smart and we're so used to living inside the box and we're used to following what we're told to do. And so it sounds like not having that MBA and not letting what I'm imagining was a very scary experience of starting an ER and not letting that fear get in your way and just doing it. Just go ahead and doing it and staying outside the box.
Absolutely, absolutely. And there were people, like I said, I had mentors. There are people who had paved the way, and there's too many to acknowledge. But yes, your network should be able to supply you with enough of boots on the ground training if you do have good relationships.
Yeah, and I'll say as a fellow entrepreneur, I think the first, I don't know, 6 months to a year, maybe even more, is hard. It's very, very difficult, but very worth it. And I think that by living outside the box, you can have such a great impact. I mean, look at what you're doing, and these are physicians that would have left medicine, and this is emergency medicine where doctors are getting fired, not finding jobs, or leaving because it's not sustainable what's out there.
Yes, and we have 300 employees, so we hire RNs, front desk people, and radiology technologists, many of whom also had those same sort of sentiments, which is unfortunate because there's shortages everywhere, and so we listen to them. We pay them fairly, and we work collaboratively as a team, and they love it. It's also refreshed their careers. So I would say it's good when the physicians are in decision making roles and operating the business. It's good for everybody.
Yeah, I think that's how we bring medicine back, is by putting the people who care and who want to take care of the people in charge of how we run our businesses.
Right.
Well, thank you so much for coming on the show. If people want to find you, is there a way that people can find you?
Like you said, I don't do social media too much, but I am always available for a chat, coffee, or anything that may be helpful to another physician that's looking to go into the business world. So yes, I can be contacted through you or any of our contacts. And one thing I just want to say is, yeah, be brave about the business of medicine and look at it. We've been told that by hospitals and other practices, let us handle the business. You just do the medicine. And that's gotten us into a precarious situation. And so it's daunting, but acknowledge the fact that the business does affect your patient. And so holistically improving the care of your patient does start with us all getting involved in, why are we getting paid only this much? Why do we have to use only these limited diagnostics? Why do we have to use people with lesser credentials in situations where it's not appropriate and it's more dire? Those are easily answered by money, but when you're at the table, it can be answered by clinical acumen. And so that's something where you should not shun away from business. You should go towards it because it will affect your patient.
I couldn't agree more. Thank you so much for coming on the show. I'm so excited to have you. This is gonna change people's lives. I know it. And thank you so much. I appreciate it.
Thank you. Thank you for having this. I appreciate being